Could you introduce us a bit from what you are doing there at the AG with the iZi Experience Home and all this project?
Yes, of course. I will start. Thank you, Gabrielle. Hello, everybody. I am Nicole Menke from the municipality of The Hague. I'm a program manager along with Christiane and some other team members. Our goal is to look after vulnerable people in The Hague and to make sure that they can have a nice, lengthy and sorry, you can see me better now, I hope. And they can live comfortably at home. So we've made a little bit of a presentation, a short one, to take you along our adventure in the iZi Experience Home. As you can see, these are our ambassadors whom we work with, and some of our team members who made it possible to start this project, because we first started as a project to see and to test in what ways technology would contribute in a comfortable way of living for elderly people. And we are now actually a program. And as you can see, one of our important approaches, one of the things that we emphasize is that, of course, it should be about our citizens. And it sounds very logical, but often they're forgotten, and they're, as we say in Holland, they're talked about, but they're not taken into, or we're not talked with what matters for them. So what is important in our approach is that they are the center, and that we work with them along with entrepreneurs, with caretakers, with institutions of education and knowledge, healthcare providers, as I just said, and also other organizations that are important in the chain. I will tell shortly about our principles and what iZi is all about, and then I'll leave it up to Christiane to tell something about the experiences with our ambassadors and the inhabitants here in using technology. So one of the main purposes of iZi, as you can see, iZi is, by the way, it's a logo. It's not a it's also a little bit of a word, but it's actually two people sitting at a table talking together. If you can see it, I'm pointing to the logo over there, and that is actually what we're about. iZi is creating a community of people who gives us feedback. Who we can talk to about their experience in using technology, because for us it's very important to be equipped with all the knowledge about using technology, because I think it's similar in a whole lot of countries. We're facing enormous costs in healthcare, and we're also facing less personnel who is available to help people who need care. So with those challenges, we're looking for other solutions to help our vulnerable people, and one of those is technology. So how did we go about it? We started by investigating here in one of our areas in The Hague, where people are not too poor, but are on a social level, who are not having all comforts in life, but who also want to stay home. So we asked them, what do you need? What do you need to have a nice, comfortable life as you are getting older? And of course, the main topic here was technology. And the central topics that came out of it were security, mobility, and also social interaction. So taking those topics into account, we started workshops with the same people who lived around here. And that was the beginning actually of our approach. An iterative approach in which we said, we're not going to write everything down. We're not going to write all policy papers, what they need. We're going to talk to them, and I'm going to keep talking to them. So actually the approach was that every step of the way, we involved our inhabitants in what they needed. And we're still doing that. So when we came to the testing, because we selected some technology with all these ambassadors and the entire group, and there were about 102 participants in the end. We selected with them the technology they needed, and also we tested that with, they had the opportunity also to take the technology at home. And we tested that for about a year, 2 years. In the beginning of this year, results became clear that using technology is very effective, of course, when using it in a certain way. And one of the ways, one of the important effects also was the fact that we approached them continually. Excuse the English if there are any questions because you can't hear right, please raise your hand or anything like that. So actually, the approach went about that we talked to our participants in a regular fashion, and we made them feel responsible for the things they used on one hand, and also on the other hand, the warm approach that we used made it possible also for them to become more open and to become a community with each other. So that was one of the effects also. People are also lonely, they could get together more often and they could talk about other things than only technology. So this is a bit, in short, our approach. Is that everything? Is there anything I missed, Christiane? I'm sure there's a whole lot of other things I can tell, but we've only got 10 minutes. I've got 10 minutes. Christiane is still
less
to tell something more. What is very important also about the approach is that we included the partners in this pilot, because at first it was a pilot. Now we're spreading it around all over the city. But we need partners such as the entrepreneurs, because they develop all the products, and very often the products aren't very compatible to the wishes that the participants had. So we were in close contact with some of the entrepreneurs to give them feedback on their product so they could better the product. But also with the healthcare organizations, because in the end, it's important for us that they learn to use the products as well and the technology to improve the quality of care they give and to reduce costs in the end. Another important partner was the university, who is still with us, validating all the research that we are doing using the products and so on. So that's also a very important element of our approach. I think I'm going to leave it at this. Do we have, yes. And I'm going to let Christiane tell something about her experiences with the ambassadors. Thank you.
Just before I start, any questions regarding what Nicole was telling you?
Yes.
There might be some questions.
So indeed, we are receiving a lot of questions here at the chat, and that's it. After so you have more 5 minutes where we're really interested in learning how you really create this ambassadors community to help really develop innovations in the sense of utility for the senior community. And people can leave their questions at the chat. In the end of these 5 minutes, we will have a round of questions and answers.
Oh, perfect. Oh, fine. Yeah. Well, as Nicole already said, we started directly from the start with inhabitants here in the special location, which are 5 buildings with elderly people. Well, elderly people above 55 years. So somebody about 55 wouldn't say I'm elderly, but in Holland it's a way of living. You have some apartments where you have to be 55 and older to be living in. So we started our project, our pilot here in one of those locations. And in the beginning, of course, some of the people knew each other by passing by on the streets. But due to the pilot, we start with a project with technology where they had to test and where they had to think about and talk about together also about what would it mean to be 5 or 10 years older, and what would they expect getting older, and what would they hope for, and what maybe they're afraid of getting older and living at home. So they got to know each other better. And during the pilot phase, which was a year where they had to test the products, we saw, of course, especially with products from which a digital background, digital products, that the elderly had quite some issues with it, because the average age was 76. And well, for us, digital products are more common, but for somebody who is 76, a lot of them not even used a computer before. So a digital product to help them in their living at home was quite a challenge. So therefore we started with we call it a Digi help desk, a digital help desk, where some of the participants were part of, because of course there are always some who are really technical and which they like to really to help other participants to use their product, to install their product, to work with it. And so step by step, there was actually a community developing. And from the community, we had some participants who were really, really active, who really like to go to others and explain what they are doing, how products work, why eZi is very important, why it's important for elderly people to get involved with technology. And this actually became more or less our ambassadors. So they also go with us to events, they do presentations, and you see that it's a really big difference, because we also have the apartment you see in the background is the apartment we have. This is an apartment, just a normal apartment with around 90 technical products in it. So that it's open for everybody in The Hague. Everybody can come and have a look and show and test products here. And the ambassadors, the elderly ambassadors, they give the how you call it, the tour through the apartment with all the products in it, and they the people who come to visit, their experience with it, the good experience, also the experience which didn't work, things that didn't work out and why they didn't work out. So this is so much, this is very valuable, because it's so much different than if I tell somebody why a product is good, or somebody with the age of 80 tells somebody who's also 80 why a product is really working, and that he can do it, the other one, the visitor, can do it as well. So this is a really important part of this project, that we have this, we call them our ambassadors who have experience in using technology. And this is really important part. And I will show you three few items This is, of course, something maybe a lot of people already know that you can normally buy in a store, which is a robot cleaner who cleans even when you have your coffee and reading your newspaper. One of the products that everybody wanted to test because, like, oh wow, everybody liked this product. But through the matching, of course, we checked out who would be needing maybe this product. And I think we had 15 people who tested this product, and 14 products came back. And they came back because the people not really needed it yet. And because they said, well, it doesn't vacuum the way I normally do it, and it has a different pattern, and it's strange. I do it myself. But one person was really happy with it because this person has asthma, and she was really happy because this product, the vacuum cleaner, can do it every day. She cleans every day her apartment, and only once a week now she has to do the difficult parts where the vacuum cleaner can't get to. So for her, it's really a necessity, and for the rest, it was a kind of comfort. So that makes also a difference when the product is, when the technology is used. Is it a comfort item, or is it really a necessity? So just to show that it's such a simple product can make the difference to one person. The other one is, you already saw it in the intro that Gabriel showed you, is the tiny Bot Tessa. Which is this kind of mini social robot you see here, which comes together with an app. We have it on our iPad here. And this is a product was developed firstly for people who lose track of time and lose track of normal daily routine. So it's a product that is not only for the person who lives alone or lives in, for example, in this apartment, but it's actually a product which is used by the caretaker, because the caretaker can program via the app a total daily routine, from getting up, having something to eat, doing a cup of coffee, having a walk around the house, everything, going to the dentist, going to your physician, or your grandchild having a birthday. Everything can be programmed in this product and reminds the person who gets a little kind of dementia, for example, to that something is happening. This was the first idea of this product, but now we also see that the product is also useful with how you call it, autism, because you can program really step by step in a script. So, for example, somebody who was not able to shower herself in the morning, so her boyfriend had to help her through the part of getting a shower. With the Tessa, they scripted every step of taking a shower into the Tessa, and the Tessa told every step in a very calm way. So the person was able to go and shower herself, and her boyfriend was doing something totally different. So for both people, was it really a relief, because she had herself getting a shower and her boyfriend had time to do something different. Just to show that technology can serve different kinds of needs for different kinds of people. And the last thing is, we call it the Japanese toilet. Of course, now you have more fancy ones which are already integrated, but we chose top-on Japanese toilet, especially because a lot of people already have a toilet, and this one is like a top-on which you can use on your normal toilet already, and you only need some watering, and then you go. And this toilet was a really big game changer for one person who had how do you call it?
Rheumatics, something like that.
Yeah, rheumatics. She couldn't really move anymore, and she couldn't clean herself. That was the big thing, actually. So every time she needed to go to the toilet, she had to ask one of her caregivers, can you help me going to the toilet? Due to this toilet, she can clean herself, she can go whenever she wants, and she doesn't have to ask anyone anymore. So she's really happy with it, and such a toilet, just a normal toilet, can make such a difference to people. And this is also the stories we tell here, and our ambassadors tell people who come to visit, and give them some kind of inspiration, what technology can do for them. And sometimes normal things you can already buy in a normal store can make such a difference to people. For the one is it comfort, and for the other one is necessity. So this is actually what iZi is all about.
Wow. So thank you very much for your introduction.